insanity on account of an unfortunate love, unrequited love. I have loved that person, I have given so much, I did this, I brought her that gift, I brought this gift, I give her big Valentine Day party, I do this, I do that, but she just does not respond. Just does not respond. That is important. It is one-sided, huh? One-sided. Or the maximum two-sided is they have this feeling that the opposite person is not sharing his feeling or coming out or expressing this feeling. But it is always like, I have not got the love that I have given. Great excitement caused by music 1 hour after it, general and copious perspiration. Okay? We learned the perspiration thing. Yes, no? Okay. Next, ludicrous and lascivious mania, which is similar. That's why that patient at first got hyoscyamus. Fainting paroxysms. A girl stimulating, fainting, and insensible looks sideways to watch the effect produced on those around her. This is exactly the symptom of that patient, no? Huh? Fainting and paroxysm. A girl stimulating, fainting, and insensibility looks sideways to watch the effect produced on those around her. Okay? Next. The colors red, yellow, and green, and particularly black, produce heavy mist before the eyes. Hysteria with crossness. No, crossness is that abusive and striking behavior. Great tachycardia and irritability. Desire to strike himself and others. Next. Desire to joke, to play, and to laugh. Extreme gaiety. Okay? Singing until becoming hoarse and exhausted. Okay, singing, dancing, so much, so intense. The patient laughs, dances, and runs and gesticulates without noticing he is an object of astonishment. Next. Profound melancholy, sadness with tears, followed by ravenous hunger, longing for articles which are not relished before. Not relished before means all those kinds of indigestible things. Fear and shaking. The patient cannot find a suitable place where to hide himself. Thinks he is going to be assaulted. You remember I told you, one is he will do all those kind of mischief. You scold him, and what he'll do? First go and sit in one corner and cry. One more thing is, what they will do? They play, and then they will do some kind of mischief. They will harm some boy. They will hurt him, they will tease him, they will do something. And then they have this fear that now he will go and complain to his mother that I have teased him. So, like nothing happened, they will come and sit in one corner and watch TV. And mother is astonished. This guy does not sit like this. Never. Why is he sitting like this today? So, slowly the mother comes to know. Today, he must have done some mischief. Some mother is going to come. Okay? That is one. Second is, another important aspect in the consulting room is these patients, tarantulas or spiders, one aspect of them can be that they will come to your chamber and sit very quietly. Like they are the most obedient and most perfect, the best child and the most well-behaved child. You feel what is going on? Why is the mother talking like this? He's like very good, obedient child. And when the mother starts to tell what his real story, you will see he hate his mother. Chup, why are you telling lies about me? I am not like this. No, I am not like this. No. And many times, you may prescribe remedies which are well behaved, good to tarantulas because you feel they are so well behaved. Only after you come to know the real story that actually that is a part of the feigning part or the build up or drama part. Outside I am like my best child, very good, well mannered. But inside there is lot of mischief. Okay? That is it. Okay, next. Cross tendency, to get angry and to speak abruptly. Okay? Irritable and cross at the least contradiction. Great irritability, rage, fury, loss of reason, desire to strike himself and those and who prevent it. Great haste in whatever I undertook. It is a constant fear that something would happen to prevent my finishing it. Okay, this is that constant. One is the pace, that is very fast. Second is this constant fear that something will happen, some kind of attack will happen on me. I would start up suddenly and hastily change my position through fear that something would fall on me. When walking, I would stop short or suddenly throw my head to one side, thought fear of striking it against some imaginary object which appeared to be suspended a few inches above my head. Okay? That is the abrupt behavior. They constantly, something is going to come and hit me, something is going to come and harm me. So, abrupt actions they start to do. Next. Sudden alteration of mood. Foxy. Sudden alteration of mood means what? One is abrupt. Another, sudden alteration of mood means like this. I told you, mother scolds, he goes and sits in one corner and you are thinking he is what? Weeping. And actually he is laughing. So the mood is change so fast because everything is drama. Actually he does not feel guilty that he has done something. So there are no moral values. One thing that is important is there are no moral values. I hurt someone, somebody got hurt because of me. No consideration. Somebody got hate, somebody got hurt. No, there are no moral values, no guilt. Did you read guilt anywhere? In spite of he hitting, striking, biting, no guilt. No moral values. Destructive impulses. Moral relaxation. You see? Moral relaxation. Feigns sickness. Sudden fox-like and destructive efforts requiring the utmost vigilance to prevent damage, followed by laughter and apology. Okay? So laughter and apology. One patient, what she said, she was narrating to me her history of while narrating, impulsively, suddenly she would laugh. So I observed half an hour passed, 1 hour passed. So I asked her, why are you laughing in between? She said, this is my main problem. I said, why? What happened? I and my husband always have fight because I laugh. I said, why? What is the problem with laughter? No, the problem is, I laugh on anything. Once what happened that we were having a discussion. The family was having a discussion, and during that discussion, a talk of my husband's mother started. So we were talking, and I suddenly laughed and said, "Arey, his mother is expired," and I started to laugh. So he tells me, you don't understand on what kind of things to laugh and what not to laugh. And I laugh on everything. And he gets good. So nowadays I am trying to control, but I am not able to. I just laugh. It just comes out. Okay. So that is what is jerky, involuntary, uncontrollable laughter. Everything is what you say, a prank for them. How I said, his mother expired. That is also a big laughter for them. Okay? Next. Malingering, when there are no observers, there is not hysteria when attention is directed to her. She begins to twitch, feigns fainting, insensible, but looks sideways to observe the effect on those around her. This is a repeated sentence. Next. Now, some symptoms. This is more or less the picture of Tarentula. Or this is not just the picture of Tarentula. This is actually picture of all spiders. Whatever I told you, the mental picture, it is common to all spiders. Certain aspects predominate in certain spiders. Some of the spiders will do to differentiate. Okay, at a later time. Okay, soul of remedies. Some symptoms from soul of remedies which are peculiar of Tarentula. Whistling when passing urine. Desire for ashes. Desire for ashes means the patient wants to eat something that is burnt or roasted. जला हुआ चीज खाने को ज्यादा मजा आता है. Burnt rice, burnt chapati, burnt vegetable, that they like more. Activity fruitless. Okay. Constipation, purgatives, no relief from. Okay. That symptom you remember of constipation, what was that? Rolling of head sideways. In pain. Next. In kleptomania. What does kleptomania mean? Steal. Why stealing will come? Nah. Obsessive. मांगा नहीं दिया, चोरी कर लिया. Okay, you ask, don't get, steal it. Because I want something. Anything I want to have. I have to. Compulsive desire to have it. I have to have it. Kleptomania. Death agony. Get this symptom? Next, it is of service in nymphomania and pruritus of the vulva, priapism.